Good afternoon, everyone, and thank you so much for joining us. My name is Janelle Tomlinson, and I'm indeed honored to be moderating this afternoon's event. So we have convened this afternoon for the official launch of the 5-year EU CARIFORUM Climate and Health Project, which has brought together a host of stakeholders across the region in an effort to facilitate collaboration, communication, and cohesion around two very important issues: climate change and health. Today's event is being broadcasted live on YouTube, Twitter, and Facebook in an effort to ensure that we share this very important event across multiple platforms so that we can have a host of different audiences tuning in to our discussion. I'd especially like to welcome our speakers and our special guests, and would like to use this opportunity to acknowledge some of them who will be speaking to us this afternoon. Firstly, I'd like to welcome Dr. Etienne, the PAHO/WHO Director. Honorable Roosevelt Skerrit, the Prime Minister of the Commonwealth of Dominica, unfortunately will not be able to join us and will be ably represented by Dr. Irvin McIntyre, the Minister of Health. The CARICOM Secretary General, Ambassador Erwin LaRocque, is also in our midst this afternoon, and we also have the head of the delegation of the EU to Barbados, the Eastern Caribbean States, OECS, CARIFORUM, and CARICOM, Malgorzata Wasilewska. The General Secretary of the Central American Integration System, Dr. Vinicio Ceroso, Secretary General of the Amazon Cooperation Treaty Organization, Ambassador Alexandra Moreira, PAHO and WHO representatives and sub-regional program directors, head of other regional organizations, project partners, specially invited guests, and of course, members of the media. Thank you so much for joining us, and we'd like to welcome you to the event. Now, all these stakeholders have convened and will be working over the next 5 years to pretty much utilize this project as a space for the coordination and the facilitation of climate change and health activities at the Caribbean sub-regional level, and to also utilize it as a platform to promote tools that seek to measure co-benefits related to mitigation, undertaking health assessments, and mainstreaming resources in national adaptation planning. And all these activities are particularly important for small island developing states as ours. As with climate change being deemed the challenge of the century, we must prioritize actions that seek to climate-proof our sectors, especially one as important as health, and to ensure that we implement the necessary mitigative and adaptive measures at all scales. An especially important component of this project is the inclusion of youth, including myself, as actors in the creation of climate change strategies and response actions. And I am particularly excited for the activities and for the discussions that will emerge over the course of this project. As I mentioned before, we have a cadre of speakers this afternoon highlighting and representing different partners, and they will bring remarks and highlight to us that there are different engagements and the overall expectations coming out of this project. So without further ado, I'm going to open up the space for our speakers, and I'd like to use this opportunity to invite our first speaker, which is Dr. Carissa Etienne, PAHO Director, to bring greetings and to welcome the attendees. Dr. Etienne?
Thank you, Ms. Tomlinson, and good afternoon. I have the distinct pleasure to recognize and acknowledge honorable ministers and governmental officials, His Excellency Ambassador Erwin LaRocque, Secretary General of CARICOM, Her Excellency Ambassador Wasilewska, Head of Delegation of the European Union to Barbados, the Eastern Caribbean States, OECS, and CARIFORUM, Her Excellency Ambassador Alexandra Moreira, Secretary General of the Amazon Cooperation Treaty Organization, ACTO, His Excellency Ambassador Dr. Vinicio Cereso, Secretary General of the Central American Integration, Director of CARIFORUM, and other heads of regional agencies, colleagues, distinguished guests, ladies and gentlemen, members of the media, and the youth who are present with us. I am pleased to be here today to welcome you to this launch of the European Union CARIFORUM Climate Change and Health Project in the Caribbean. Let me begin by expressing my thanks to the European Union for their support and partnership towards this project in the Caribbean, as well as for the other projects in the region of the Americas. I wish also to thank CARICOM and CARIFORUM for co-leading this initiative with PAHO for the benefit of the Caribbean countries. Climate change is of immense importance for the Caribbean, increasing the vulnerability of these small island states and putting the lives and livelihoods of its population at risk. In this regard, the EU CARIFORUM project seeks to contribute to the response to what is clearly an existential threat to this subregion. The project is unique in that it brings together the work of 5 Caribbean organizations, as well as PAHO, other UN agencies, and others, through a partnership that is aimed at improving health conditions across 16 countries. The project is responsive to the CARICOM Caribbean Cooperation in Health Strategy, aimed at reducing mortality and morbidity from health consequences of climate change and promoting linkages to the environmental determinants of health. Consistent with developmental approaches in the Caribbean, it emphasizes multi-sectoral and interdisciplinary action to address climatic impacts on health and supports a cadre of new climate and health leaders. It promotes evidence for the frequently hidden health co-benefits of climate action and supports the implementation of health-related plans and resources for mitigation and adaptation for health. This project represents the first regional interdisciplinary effort of its kind that will synergize Caribbean technical support, advance the public's understanding of the impacts from climate change on health, and build the case for strengthening the health response. The EU CARIFORUM project will also support countries to access climate funding. The World Health Organization, and therefore PAHO, is now a delivery partner to the Green Climate Fund. And PAHO has been working with Caribbean countries on a proposal for the GCF to access additional fundings and therefore complement the activities covered by the EU CARIFORUM project. Similar project proposals are currently being prepared for other subregions and countries of the Americas. Distinguished ladies and gentlemen, over the past 8 months, the world has grappled with a pandemic, the magnitude and severity of which had not been experienced for a century. I can't help but highlight some of the important lessons which we have learned during this time and the relevance for the response to another disaster, climate change. Indeed, COVID-19 has provided society with a much deeper understanding of the linkages that bind us as a global community and has re-emphasized some fundamental lessons. Lesson number 1, together we are strong. We cannot do this alone. We are at a crucial point in time in the Americas when we must increase our solidarity and intergovernmental collaboration to address these issues that are arguably the health challenges of the century. The Americas must embrace mechanisms for countries to come together around climate change. I'm especially pleased with the partners who are here this afternoon. And I do believe that the strength of having CARICOM, SICA, and ACTO working together provides a strong platform for cooperation between integration mechanisms. The second lesson, invest in health systems. Robust and well-resourced healthcare systems are vital to protect us from the impacts of pandemics, and they are also necessary to address the health impacts of climate change. It is now more evident than ever that access to healthcare, equity, and protection of the environment are the underpinnings of a robust global economy. As with COVID-19, climate change disproportionately affects the most vulnerable, the poor, and low-income populations, those without access to the basic social and environmental determinants. The COVID-19 pandemic has shown unequivocally the importance of strengthening health systems, health surveillance systems, early warning systems to trigger adequate measures of prevention, primary care response, and quick recovery. The climate crisis demands a similarly vigorous participation from the health community in close coordination with other sectors. The third lesson, preparedness and prevention are key. Like in a pandemic, delay or neglect in not taking preventative measures leads to outcomes that can be both widespread and highly destructive to all aspects of society. Without the necessary investment in preparedness plans and prevention measures, the outcomes will be more costly and the inequalities more evident. Friends, let us be mindful that COVID-19's emergency response and recovery efforts represent an opportunity to reassess our development models and to build healthier, more sustainable, and resilient societies for these and other future challenges. Unfortunately, while responding to the COVID-19 pandemic, we were not spared the ravages of climate change. Just a few weeks ago, Hurricane Iota hit Central America, followed 1 week after by another major storm, Eta. This has been referred to by one writer as a Greek tragedy. Iota was the season's 30th named storm. And this is not new to the Caribbean. We remember all too well when in 2017, Hurricanes Irma and Maria also hit within weeks of each other. Sadly, however, adverse climatic weather events are now not limited to the designated hurricane season, but are occurring in the Caribbean throughout the year. Climate change is a global threat that affects us all, but the Americas are particularly susceptible to climate change. The Caribbean is perhaps the most vulnerable region of the Americas, with low-lying land, dependence on agriculture, tourism, warming, climatic events, including hurricanes, floods, landslides, heat waves, drought, etc. It also has seen climatic-related changes linked to the spread of infectious disease and mental health issues. Our health systems in the Caribbean are already overburdened and face additional and exacerbated challenges caused by climate change. Increasing the human capacity to understand and address climate change while increasing the resilience of health infrastructure are paramount to offer quality services to the population in this new environment. The truth, however, is that the CARIFORUM region has been at the forefront of responding to the threats of climate change, bearing what is an inordinate burden, the cause of which they bear very little, if at all, responsibility. I want to take this opportunity again to commend the Prime Minister of Dominica for his leadership in working towards Dominica becoming the first climate resilient country in the Caribbean. And I can assure you that this is challenging. In 2018, the Caribbean Action Plan on Health and Climate Change was signed by 17 ministries with a detailed and clear path forward to prevent and prepare for the impacts of climate change on health. This plan provided momentum for addressing climate change in the Caribbean and proved to be a vital step towards the inception of an innovative and far-reaching proposal that would become eventually the EU CARIFORUM Strengthening Climate Resilient Health Systems in the Caribbean. So we are here today to officially launch this project that brings together a rich partnership working to fulfill our common vision for a Caribbean where health is central to the climate dialogue. But the Caribbean is not alone in the response to climate change and health. And therefore, I'm so pleased to share that yesterday, PAHO and Orasconu launched the Andean Plan of Action on Health and Climate Change, building on the successful process in the Caribbean. Similar sub-regional initiatives are being conducted in Central America and in the Southern Cone of South America. It is my hope that through this event and upcoming meetings, that the sub-regions can embark on an exchange of best practices and cohesive approaches to common issues, strengthening collaboration within and between blocks of countries. In conclusion, we find ourselves in a new era where COVID-19 and climate change have become among the most pressing threats to health, requiring us to work together across communities, islands, subregions, and entire continents. The type of project being launched today is a prime example of this type of interdisciplinary effort that enables us to strengthen the health system. Let me again extend my gratitude to the European Union for supporting the Caribbean to become a model towards climate change planning and prevention. We are in this together, and it is only together that we must work to ensure that our countries and our people will have a healthy and prosperous future. I reiterate PAHO's continued support to the process of ensuring such a future. I thank you and I look forward to the rest of this afternoon. Over, thanks.
Thank you so much for those words, Dr. Etienne. And kind of just to reiterate some of the key points that you highlighted in your remarks quickly, I appreciate the fact how you started off highlighting climate change and overall vulnerability and how this project will seek to mitigate as best as possible this existential threat of climate change that has emerged and that will continue to impact us primarily as small island states. And I'm happy how you highlighted the fact that the project was consistent with the development objectives of Caribbean related countries, and how it will help to support the implementation of health related plans and resources. Another profound thing that you highlighted as well was those three key points that you noted coming out of COVID. The fact that together we are strong and that we cannot do it alone. I particularly like that point that you highlighted, the importance of investing in health systems, and of course, that the fact that prevention and preparedness are key. And as you rightly said, health must become central to the climate dialogue, and we must work to ensure a healthy and productive future. Thank you so much for those words, and we'll continue the dialogue. And now I'd like to have Mrs. Margaretha Wasiluska, the EU ambassador, to bring her remarks as well.
Thank you so much, Janelle. Just checking the quality of sound. Can you hear me?
Yes,
well?
I can hear you very well.
Thank you very much. Pan American Health Organization, World Health Organization Director, Dr. Carissa Etienne, Minister of Health, Wellness, and the New Health Investment for the Commonwealth of Dominica, the Honorable Dr. Irving McIntyre, CARICOM Secretary General Ambassador Irvin LaRocque, Secretary General of the Amazon Cooperation Treaty Organization, Alexandra Moreira, General Secretary, Central American Integration System, Dr. Vinicio Cerezo, PAHO representatives and sub-regional program coordinators, heads of regional organizations, project partners, specially invited guests. I'm very impressed to see how many are attending this meeting. Member of the media, ladies and gentlemen, good afternoon. On behalf of the delegation of the European Union to Barbados, the Eastern Caribbean states, OECS, CARIFORUM, I extend my warm thanks to you for your invitation to be a part of the launch of this flagship initiative. It is a particular pleasure for me to take part since I've just recently completed my accreditation here in Barbados, and this is actually the first public event that I can officially take part in. The European Union is very pleased to support ongoing efforts in the region to address the impacts of climate change and the inherent vulnerabilities of Caribbean SIDS. We are particularly pleased to collaborate with CARIFORUM and PAHO in the implementation of this action towards addressing climate impacts on public health and healthcare systems and facilitating the integration of climate considerations into planning and development for the sector. This action is timely and relevant as the region emerges from one of the most active hurricane seasons on record while responding to the COVID-19 pandemic. Although most countries were spared the devastating impacts of a large named storm, we recognize the damage caused by floods and landslides from recent extreme rainfall events, and we deeply sympathize with countries like Belize and Haiti, who have been most affected by major climate events during this hurricane season. Having worked for 4 years in the Northern Caribbean from Jamaica, I know very well of the power and devastating impacts of extreme weather events. In fact, at the beginning of this year, before the pandemic started, I had the honor of visiting Abaco and seeing for myself the devastating impact of Dorian in 2019. And I saw this quite a few months after it happened, and it was still a shocking sight to see. So I can only imagine what it was like immediately after it hit. The European Union is keenly aware of how the impacts of extreme weather and a changing climate affect the social and environmental determinants of health. We also know how such events can affect health infrastructure and national and regional capacities, and as such can undermine the significant progress seen in the region. The ongoing pandemic has exposed the vulnerabilities in healthcare systems around the globe, and the unprecedented number of storm systems in the 2020 Atlantic hurricane season has highlighted the intersect between health and climate and reminded us that these compounded vulnerabilities require our immediate attention. Not to mention the fact that I think we're really ready for 2020 to be over. The sooner, the better. As such, we are heartened by the robust and concrete steps under this program, which support a multidisciplinary approach, seeks to build an understanding of the nexus between climate change and health, and facilitates meaningful collaboration between key regional entities to strengthen the health systems in the Caribbean. The European Union is privileged to continue our partnership with an esteemed group of regional agencies that builds on a diverse portfolio of programs to support advancement in the health and climate sectors. These include the recently launched Health Strengthening Program to be implemented by the Caribbean Public Health Agency that supports efforts to combat mosquito-borne diseases. Additionally, we have also been able to support an agreement between CARFA and the Pan American Health Organization to support member states' participation in the highly needed COVAX facility to provide access to COVID-19 vaccines when they become available. This support from us will provide 1 million vaccines. I don't think I need to stress how important this will be as soon as they become available. From supporting the construction or refurbishment of health facilities in OECS countries and assisting many countries in the acquisition of necessary medical supplies and equipment to the various climate-focused initiatives and disaster recovery programs, the European Union remains committed to supporting the steps towards sustainable and resilient development in the region. This action, however, is a critical step towards ensuring that the health impacts of climate change are understood and prioritized. We recognize that the application of the One Health approach to this new initiative will further strengthen the regional partnership between Europe, as it is aligned with both the EU health strategy and the EU strategy on adoption to climate change. Both instruments acknowledge the indirect and direct effects of climate change on human health and the extent to which this global phenomenon will generate new health risks and amplify current health problems. The action is also aligned with recently adopted EU Green Deal, which provides a roadmap for climate action towards achieving climate neutrality while also supporting improvements in public health and quality of life. And that approach is not only adopted inside EU, but will also affect very much how we work with the third countries, partner countries, I should say. The European Union understands that the One Health approach, which fosters collaborative, multi-sectoral and transdisciplinary action, continues to be an effective tool to achieve better public health outcomes. We note that this approach will be also used in the ongoing fight against the acceleration of antimicrobial resistance. I can never pronounce that word very well. Ensuring the future effectiveness and availability of important medicines. We congratulate the Honorable Mia Mottley, Prime Minister of Barbados, who was recently appointed as co-chair to the One Health Global Leaders Group. This elite group of leaders will support global action towards the mitigation of antimicrobial resistance and the potentially disastrous consequences to world citizens, and we wish them every success in this undertaking. We would also like to take this opportunity to acknowledge the incredible job and sustained efforts by regional institutions and national governments in their handling of the pandemic. In the midst of a global public health crisis, governments and agencies have remained resolute in their efforts to advance climate action and to strengthen healthcare systems across the region. The European Union reconfirms its support to these efforts and remains committed to our long-standing partnership towards continued growth and development in the region. It is through partnerships like these that we are able to impact the lives of everyday people and affect change for the most vulnerable. Over the next 4 years, as we move out of this most challenging season, we look forward with hope. We remain confident in the resilience and innovation of Caribbean people and provide our assurance that the people of Europe will remain a dependable partner to support your efforts towards realizing the development ambitions for the Caribbean. And to repeat the words of Dr. Etienne, together we are definitely stronger. And the European Union is good at this. We're good at supporting the efforts of the people in our partner countries. On a personal level, I make a promise to all of you to engage on these topics as best I can over the next 4 years. Thank you.
Thank you so much, Ambassador Wasilewska, for your contribution as well. And likewise, just to reiterate some of the things that I thought resonated with me from your conversation was the importance of the intersection between health and climate. Oftentimes, we don't recognize that one affects the other and that factors that have repercussions in one do in fact spill over into another as well. So we do see where recognizing the intersections between health and climate will be particularly important for countries, communities, individuals across all scales. I'm also happy that you spoke about the need for strengthening health systems and in integrating climate change planning into the sector, because this will be particularly important as we seek to move forward and as climate change becomes more of our reality. I applaud the ongoing work of the EU in support of health-related projects, many of which you highlighted just now. And I'm also happy that you spoke to the importance of sustainable and resilient development and how these will seek to ensure that health-related climate impacts are prioritized and are recognized and are given the attention that they deserve. So thank you so much for your contribution. And I do look forward to hearing more from you as we progress in the project. Thank you so much. So next we have two presenters, and I'd like to introduce Ambassador Alexandra Moreira, the Secretary General of the Amazon Cooperation Treaty Organization, and Dr. Vinicio Cerezo, of the General Secretary of the Central American Integration System. They'll both be speaking to us, but I'll ask Ambassador Morero to start.
Muchas gracias. Yo voy a hablar en español, así que vamos a cambiar un poco el switch. ¿Me escuchan bien?
Yes.
Ok. Muy buenas tardes. Quisiera, por favor, saludar en primer lugar a la doctora CARIFORUM, Etienne, directora de la Organización Panamericana de la Salud, doctor Vinicio Cerezo, secretario general del Sistema de la Integración Centroamericana, SICA, a la doctora María del Carmen Calle Dávila, secretaria ejecutiva del Organismo Andino de Salud, así también al embajador Irwin Larroque, secretario general del CARICOM y vicepresidente del CARIFORUM, a la embajadora señora Malgorza Huasiles-Hueca, embajadora de la Unión Europea en Barbados, al ministro de Salud de Dominica, doctor Irving McTire, y a todos los distinguidos invitados, los que nos están viendo. Y como organización del Tratado de Cooperación Amazónica, agradecemos de sobremanera la invitación recibida para el lanzamiento de esta importante y relevante iniciativa y felicitar de corazón por este enorme esfuerzo que están concentrándose en este importante programa. Yo me voy a referir, existen 13 preguntas, guías, del por qué el cambio climático y la salud son prioritarias, por ejemplo, en la organización, en América del Sur y, por supuesto, en la Amazonía. Al representar nosotros como cuenca amazónica el 44% del área terrestre de América del Sur, es indudable que jugamos un papel determinante en el desarrollo regional. Pero a su vez y con sus múltiples dinámicas naturales, este bioma juega un rol esencial como regulador del clima, efectivamente dando y teniendo consecuencias en el cambio climático. Por ejemplo, a través del ciclo hidrológico que en este bioma se produce. Las condiciones de vulnerabilidad hidroclimática para nuestra región nos alerta que la temperatura promedio sugiere un aumento de 3 a 4 grados centígrados a finales del siglo XXI, muy por encima de lo observado en el periodo 1976-2005. Entonces, la vulnerabilidad integral ante sequías va a tener una directa y mayor influencia en la vulnerabilidad socioeconómica, datos que en definitiva, ustedes mejor que muchas regiones del mundo, saben que van a impactar, por ejemplo, en nuestro caso, en 40 millones de personas que habitan esta región, incluyendo, por supuesto, la mortalidad, la morbilidad, entre otros aspectos. Existe información que indica que mientras los países desarrollados representan un 2% de su población afectada, por ejemplo, con parásitos o enfermedades infecciosas, los países en desarrollo alcanzamos un 40%, gran diferencia. Estos hechos están asociados a las diferencias socioeconómicas reflejadas en nutrición, sanidad, calidad de viviendas, condiciones de trabajo y servicios básicos y de salud. Por estas consecuencias y muchas otras, el efecto del cambio climático sobre la salud de nuestra región resulta una prioridad y resulta más imprescindible aún concentrarse en ciertas convalecencias típicas de esta zona. Entre las enfermedades transmitidas por vectores en zonas tropicales y subtropicales, por ejemplo, el dengue, la malaria, resultan principales en su atención. Entonces, nuestra región, por supuesto, a nivel de los 8 gobiernos, ha establecido una prioridad para estos temas, sobre todo combinando la salud con pueblos indígenas, pero también la salud ambiental. Nosotros enfrentamos no solamente el aspecto, como todos, por supuesto, de generar mejores condiciones a los habitantes de esta región, pero también preservar y conservar y tener un uso sustentable de nuestro bioma amazónico. En resumen, las áreas de trabajo que nosotros estamos particularmente en las cuales desarrollando distintas acciones es justamente en la gestión regional de salud y asuntos indígenas. A lo largo de nuestra gestión nos ha permitido desarrollar acciones como, por ejemplo, principios y directrices para la acción de la salud en pueblos indígenas de contacto inicial, poblaciones indígenas en aislamiento voluntario. Somos una de las pocas organizaciones que trabajan con este tipo de pueblos indígenas de alta vulnerabilidad. También la elaboración de marcos estratégicos para la protección de pueblos indígenas, guía para la vigilancia en salud en pueblos indígenas, diálogos interculturales en áreas de frontera, una serie de capacitaciones a funcionarios públicos y también a líderes indígenas para la aplicación de principios y directrices. Y actualmente, con el apoyo del Banco Interamericano de Desarrollo, vamos a implementar justamente y conjuntamente la OPS Plan de Contingencia para la Protección de la Salud en Pueblos Indígenas altamente vulnerables en contacto inicial, como una respuesta a la pandemia del COVID-19. Y por supuesto, dentro de nuestras acciones, un eje transversal es el cambio climático. Entonces, en todo nuestro trabajo, nosotros tenemos siempre presente la temática de cambio climático. ¿Qué nos va a permitir hacer este importante proyecto? Informes territoriales sobre situación de salud en pueblos indígenas, con un énfasis en estas áreas de frontera, los planes de contingencia de salud para estas poblaciones, la coordinación de acciones regionales en frontera. Frontera es uno de los temas más importantes para nosotros por la movilidad que existe y por la situación de las poblaciones que se identifican y están en estos lugares, y el fortalecimiento de los mecanismos indígenas de alerta temprana. En cuanto a las ideas y oportunidades para colaborar, integrar o converger en nuestras agendas de cambio climático, salud entre Caribe, América del Sur y Central, nosotros consideramos que ambas regiones sufren de eventos extremos que impactan económica, social y ambientalmente nuestros territorios. Ya lo han dicho las anteriores intervenciones, la cantidad de vidas, la cantidad en economía y todas las pérdidas que se sufren. Entonces, a partir de la implementación de importantes programas, proyectos que ustedes están, por ejemplo, desarrollando y nosotros también, de hecho, yo considero que ya podríamos conversar acerca de una asistencia técnica que nos permita, por ejemplo, trabajar de manera conjunta en este intercambio de buenas prácticas, experiencias, conocimientos de ambas regiones que tenemos en el tema y también estas importantes acciones que van a ser implementadas. Tenemos enfrente el cumplimiento de la Agenda 2030, que yo también creo que cuantos más esfuerzos conjuntos nosotros tengamos, más oportunidad de cumplir con esta agenda también vamos a lograr. Como resultado, podríamos conocer nuestros niveles de vulnerabilidad en los diferentes, sea subniveles regionales, nacionales, locales, así también como la identificación de riesgos claves y sobre todo nuestras capacidades de respuesta, que considero que esa es una herramienta elemental para hacer frente también a estos efectos adversos. Considero que la agenda de posible cooperación y convergencia entre nuestras regiones está marcada por la voluntad política de querer sumar estos esfuerzos, y como región amazónica estamos comprometidos a trabajar y unir voluntades para este cometido. Y nuevamente, muchas gracias por la invitación y cuenten con esta región para poder trabajar de manera conjunta. Muchas felicidades.
Thank you so much for sharing. And just to highlight two quick things that I thought resonated from your presentation was the importance of ensuring that Indigenous groups, Indigenous people are not left out of the conversation as we look towards climate change and health. So thank you so much for the work that you continue to do in that space and for helping us to recall that there are vulnerable groups who need to get the attention that they deserve in these particular conversations. So thank you so much for bringing that to us. And now we will ask Dr. Cerezo to bring his remarks.
Well, sorry, I am going to speak in Spanish also because I do, but promise that the next time I will participate in this forum, I am going to.
Okay, thank you.
Okay. Muy buenas tardes a todas y todos. Extiendo un especial saludo al ministro de Salud Dominicana, señor Don Irving McIntyre, a la doctora Carissa Etienne, directora de la Organización Panamericana de la Salud, y su equipo de trabajo, a quienes agradezco su cordial invitación para este espacio tan estratégico. De la misma manera, un especial saludo al embajador Irwin Larocque, secretario general de CARICOM, a la embajadora Alexandra Moreira, secretaria general de la Organización del Tratado de Cooperación Amazónica, y a la embajadora de la Unión Europea, Malgorzata Vasilevska, así como a todas y todos los distinguidos invitados que nos acompañan virtualmente. En el sistema de la integración centroamericana SICA, valoramos como algo sumamente positivo estos espacios de articulación de agendas de trabajo entre organismos multilaterales, en especial por los potenciales mecanismos de colaboración climática y sanitaria que pueden surgir para beneficio de la región de los 8 países miembros del SICA. Podemos dar experiencias y aprender de las propias, de las de ustedes. Como sabrán,
Dr. Cerezo, this is Manuel Calvi from the CMU communication team. We have a problem with the English interpretation. We want your full speech to be understandable. So give us a second to go over the settings to see if we can fix that problem. If you,
yes, I can wait. Don't worry.
Okay, so let me work with you in some basic setting, Dr. Cerezo. If you go to the interpretation globe of the lower margin of the Zoom window, the toolbar on the right, there is an icon that looks like a globe. It says interpretation or language.
Let me look for.
The lower bar of the Zoom window, 2 will be to your right, you know?
Yes. Yeah, I'm looking for it. Okay.
You found it?
I have the Zoom. It means back to the meeting or?
No. It's a globe. It's an icon that looks like a globe, and it says interpretation, or it says language.
It's a globe. Okay. I found it.
You found it. If you click on that icon,
I did it.
Please select Spanish.
Okay.
Okay. And then in the same icon, if you click again, there is an option at the bottom that says que dice mute original language.
No, okay.
Click that too.
I click Spanish.
Y después hace un clic
okay.
Mute original language, que está ahí mismo.
Sí, bueno. Ok.
Ahí. Okay.
Ahorita lo prendo.
Sí. Y listo. Esos dos y ya.
Ok.
Vamos a hacer una prueba. Si puede hablar un poquito y mi colega va a chequear la interpretación en inglés, por favor.
Ok. Let me check.
Hablen en español un poquito, por favor, para mí.
Esta alta vulnerabilidad regional fue uno de los temas centrales que se destacaron.
It's working, Manuel. Go ahead.
Okay.
You can start over, Dr. Vinicio, please.
Okay. Okay. Esta alta, start over.
Depende de usted. Va a depender de usted, de verdad.
Okay. I begin in without the salutes, say hello to the people.
Okay.
En el sistema de la integración centroamericana SICA, valoramos como algo sumamente positivo estos espacios de articulación de agendas de trabajo entre organismos multilaterales, en especial por los potenciales mecanismos de colaboración climática y sanitaria que pueden surgir para beneficio de la región de los 8 países miembros del SICA. Como sabrán, la región centroamericana y el Caribe se encuentran entre las más vulnerables del mundo ante los efectos del cambio climático. Solamente en este año hemos experimentado el impacto de más de 30 tormentas tropicales, desde las tormentas Amanda y Cristóbal hasta los recientes huracanes Eta e Iota, que afectaron a más de 3 millones de centroamericanos. Esta alta vulnerabilidad regional fue uno de los temas centrales que se destacaron el día de ayer en el histórico diálogo SICA-ONU, donde los jefes de Estado y de Gobierno del SICA expresaron al secretario general de Naciones Unidas la urgente necesidad de reconocer los impactos sin precedentes que no solo Centroamérica, sino visto desde una dimensión más amplia, la región centroamericana y del Caribe han recibido durante los últimos años. A pesar de que nuestros países emiten mucho menos del 1% de dióxido de carbono, los estragos que sufrimos derivados de los fenómenos climáticos implican una costosa factura humana, socioeconómica y ambiental que tiene un considerable impacto en el PIB, lo que implica la reorientación de recursos que deberían destinarse al desarrollo de los pueblos en la atención de emergencias o más urgente ahora con la atención de la pandemia del COVID-19. Por ello, se planteaba la necesidad de acceder con mayor facilidad a mecanismos de financiamiento internacional para fortalecer la recuperación y la mitigación y adaptación de nuestros países frente al cambio climático. Desde el SICA, consideramos fundamental abordar los determinantes sociales y ambientales de la salud, muchos de ellos vinculados a la degradación y contaminación de los recursos naturales como agua, aire y tierra, aumentar la resiliencia climática de los sistemas de salud y reducir los obstáculos para consolidar territorios saludables y productivos. A través de la Secretaría Ejecutiva de la Comisión Centroamericana de Ambiente y Desarrollo, hemos desarrollado la Estrategia Regional Ambiental Marco 2015-2020, la cual ha tenido importantes resultados en la gestión institucional de los territorios y ecosistemas forestales, gestión integral del recurso hídrico, la reducción de los niveles de contaminación en los procesos productivos mediante la armonización de marcos normativos nacionales, producción y consumo sostenible, el desarrollo de instrumentos de saneamiento ambiental, entre muchas otras acciones que han incidido en asegurar la sostenibilidad ambiental de los ecosistemas de la región para una vida más sana. Además, de manera intersectorial se ha trabajado con los consejos de ministros de Agricultura, Ambiente y Salud, CAC, CCAD y Comisca, en la implementación de la Estrategia Regional Agroambiental y de Salud, ERAS, la cual se ha desarrollado en áreas como la armonización de la oferta de ecosistemas y la biodiversidad regional, el uso sostenible y adecuado de la tierra, los procesos de adaptación y mitigación del cambio y la variabilidad climática, una inteligente gestión de negocios ambientalmente sana y el desarrollo de espacios y estilos de vida saludables. Estas herramientas son posibles gracias al activo extraordinario que representa el SICA como proceso de integración e instrumento estratégico para el futuro de nuestros países y para toda la región. Si trabajamos juntos, sé que podremos garantizar la salud de nuestra población a través del acceso a una fuente de agua mejorada, la reducción de los desechos de sustancias tóxicas a través de la seguridad alimentaria, la disminución en la contaminación del aire y ahora de los desechos electrónicos de nanopartículas, microplásticos y productos químicos que afectan directamente a la salud. Para lograr esto, es indispensable una transformación de nuestras matrices productivas hacia unas más equitativas, digitales y sostenibles en el largo plazo. De ninguna manera podemos hablar de desarrollo humano mientras los separemos de la armonía con el medio ambiente y con su efecto hacia nuestras sociedades. Debemos ser capaces de construir un futuro post-COVID que corrija las deficiencias de los modelos de desarrollo anteriores a la pandemia y que América Latina y el Caribe se conviertan en un referente global de resiliencia y sostenibilidad. La gestión integral del medio ambiente requiere de un esfuerzo coordinado de la institucionalidad pública, el sector privado y todos los demás sectores de la sociedad, en este caso a nivel regional, en la que deben converger las distintas instituciones y autoridades con los de salud, gestión de riesgos, energía, agricultura, industria, entre otras, pero también de nuestros socios para el desarrollo. En este sentido, la Unión Europea ha priorizado la consecución de los objetivos de desarrollo sostenible a través de fondos verdes para mejorar la resiliencia al cambio climático en zonas vulnerables y la adopción de medidas de eficiencia energética en las micro, pequeñas y medianas empresas MIPYME centroamericanas, así como el apoyo en el desarrollo de proyectos que garanticen promover la sostenibilidad ambiental. La reactivación y la recuperación de los centroamericanos ante las crisis por el cambio climático y de la pandemia del COVID-19 dependerán de los nuevos pasos que definamos juntos como región, Centroamérica y el Caribe. El reconocimiento del aporte al desarrollo que ofrecen los esquemas de diálogo político, cooperación intergubernamental e integración regional es determinante para alcanzar estos propósitos. Estamos rescatando el diálogo político al más alto nivel, porque solo así podremos transformar nuestras ideas en realidades. Como Secretaría General del SICA, nos ponemos a completa disposición para desarrollar agendas de trabajo conjuntas con otros mecanismos de integración regional, como lo es el CARICOM, con quien ya hemos tenido una agenda de trabajo en materia de seguridad y con quienes recientemente hemos compartido avances de nuestro plan de contingencia regional frente al coronavirus. De la misma forma, la articulación regional que pidamos hacer entre el SICA y la Organización del Tratado de Cooperación Amazónica puede generar interesantes perspectivas para desarrollar proyectos e iniciativas que incentiven el desarrollo sostenible y la inclusión social de toda la región. Antes de finalizar, permítanme agradecerles por el espacio brindado. Esperamos que el lanzamiento del proyecto EU CARIFORUM sirva como referente para crear muchas nuevas iniciativas más en la zona del Caribe y Centroamérica, las cuales precisan de la solidaridad internacional para salir adelante como región frente a los impactos que hemos recibido y de la solidaridad y esfuerzos compartidos entre nosotros. La historia nos ha permitido vivir estos momentos por una razón, para tener la oportunidad de transformar realidades y acercarnos más como región, el Caribe y Centroamérica. Porque frente a este complejo escenario, nadie se salva solo y solo juntos saldremos adelante. Muchas gracias.
And thank you so much, Doctor. Another recurring theme that I have seen across the presentations thus far is the fact that despite how vulnerable we may be as a region, as individual countries, partnerships and collaboration will prove important. And this project is just one such effort that is being put forward as, you know, an avenue, as a space for different entities, for different stakeholders to come together in the name of climate change and health. And thank you so much for the work being done by the Central American Integration Systems. Once more, we see where, again, in the face of COVID, irrespective of the challenges, you have continued to provide support, and we thank you so much for that. At this point, I'd like to introduce Ambassador LaRocque, the CARICOM Secretary General and the co-chair of CARIFORUM. Ambassador LaRocque.
Thank you very much, Madam Chairperson. Dr. Carissa Etienne, Director of the Pan American Health Organization. Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Investment of the Commonwealth of Dominica. Your Excellency Małgorzata Wasilewska, Head of the Delegation of the European Union to Barbados, the Eastern Caribbean States, the OECS, and CARICOM and CARIFORUM. Your Excellency Alexandra Morea, Secretary General of the Amazon Cooperation Treaty Organization. Dr. Vinicio Cerezo, General Secretary of the Central American Integration System. Heads and representatives of the Caribbean Public Health Agency, CARFA, the Caribbean Community Climate Change Center 5Cs, the Caribbean Institute for Meteorology and Hydrology, the CIMH, the University of the West Indies, and other CARICOM institutions, representatives of member states of the CARIFORUM. I also want to recognize our moderator, Janelle Tomlinson, and the youth of the Caribbean who have been formidable partners with us in the struggle against climate change. 1.5 to stay alive will always stick in my memory in Paris. Thank you very much. Distinguished ladies and gentlemen, the Caribbean is confronted with numerous challenges, but there is no doubt that the most urgent and the greatest threat is climate change. It is no exaggeration to say that climate change threatens our very existence. We've experienced its devastating effects, mainly through the greater frequency and intensity of storms, unusually heavy rainfall in the off-season, drought, and rising sea levels. There is, however, another less obvious consequence, the effect on health. The overall health effects of a changing climate are overwhelmingly negative. Climate change affects many of the social and environmental determinants of health: clean air, safe drinking water, adequate food supply, and secure shelter. That is why this project, Strengthening Climate Resilient Health Systems in the Caribbean, is so critical at this time, and it is my pleasure to participate in its launch. This project brings with it a great deal of expectation for a number of reasons, chief among them being the need for Caribbean-specific data and information to drive policy interventions and actions. Perhaps even more urgently, it is the expectation that this intervention will address the need to shore up the resilience of this region to the impacts of economic, health, environmental, and social crises like the COVID-19 pandemic we are currently battling. Climate change and the COVID-19 pandemic as single occurrences are devastating for vulnerable countries such as small island and low-lying coastal developing states, SIDS, like CARIFORUM member states. When combined, the consequences and toll on the lives and livelihood of our peoples are enormous. To combat these challenges, our region has come together using the institutions that we have established and which will be involved in the implementation of this project. These include the Caribbean Community Climate Change Center, the 5Cs, the Caribbean Public Health Agency, CARFA, the Caribbean Institute for Meteorology and Hydrology, CIMH, the University of the West Indies, and the Caribbean Agriculture, Health and Food Safety Agency, CAFSA. St. George's University of Grenada will also participate. Under the project, CARFA will design, develop, and pilot an integrated surveillance system, inclusive of a model for expansion and sustainability of the system in 3 CARIFORUM countries, with a preliminary focus on zoonotic, vector-borne disease, foodborne and waterborne disease, respiratory disease, and heat-related illness. The 5Cs will advance the development of health and climate change concept notes for funding. And as we know, the 5Cs is one of 2 regional institutions accredited to the Green Climate Fund. CIMH will develop an early warning system for Sahara dust in one of our CARIFORUM countries. And this, of course, will build on the excellent work CIMH has already been spearheading in early warning systems for drought in key economic sectors. UWI, the University of the West Indies, will foster an interdisciplinary cadre of 15 climate change fellows from across the region, trained in climate change, One Health and leadership. And lastly, the CARICOM Secretariat will ensure that the outputs of the project will be submitted to the Council for Human and Social Development on health and the Council for Trade and Economic Development on environment for endorsement of the major outputs. We'll also ensure that the engagement of the youth of CARICOM through the CARICOM Youth Ambassador Program will be active in this project. The Pan American Health Organization, which played the leading role in negotiating for the funds for the project, is the implementing agency with overall responsibility for coordinating the work. An important element of this project is the provision made for special assistance of 1.3 million euro to be given directly to Haiti in its efforts to address the COVID-19 pandemic. This aspect will also be managed by PAHO. I thank the European Union for its support, which includes the allocation of approximately 60 million euro under the Caribbean Regional Indicative Program to climate change, disaster management, and the management of natural resources. The Caribbean collectively decided to allocate at least 7 million euro to the program, which is being launched here today. Excellencies, ladies and gentlemen, at the recent launch of the State of the Caribbean Climate Report, Professor Michael Taylor, the director of the UWI Climate Studies Group, made the observation that climate change is rendering our development pillars unreliable and will make our development goals unattainable. This is an unfortunate reality, not only for our region, but for all SIDS. According to the World Health Organization, all populations will be affected by climate change, but some are more vulnerable than others. People living in SIDS are particularly vulnerable. Children, in particular children living in poor countries, are among the most vulnerable to the resulting health risks and will be exposed longer to the health consequences. The health effects are also expected to be more severe for elderly people and people with infirmities or pre-existing medical conditions. The WHO says that between 2030 and 2050, Climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress. The direct damage cost to health is estimated to be between $2 to $4 billion per year by 2030. Tellingly, areas with weak health infrastructure, mostly in developing countries, will be the least able to cope without assistance to prepare and respond. It is therefore critical that our member states have access to concessional development financing based on a universal vulnerability index. Within our region, the impact has the potential not only to affect the quality and delivery capacity of health services, but also affects other development factors, such as labor productivity, and more importantly, the overall health and well-being of our citizens. Extreme high air temperatures contribute directly to deaths from cardiovascular and respiratory disease, particularly among elderly people. Pollen and other airborne allergies levels are also higher in extreme heat. The impact on respiratory conditions is seen every year as the region braces for the influx of Sahara dust, a phenomenon propelled by the effects of global climate change and land degradation and desertification. The increased incidences of drought we expect to see as a result of climate change can also compromise sanitation services critical to COVID-19 containment measures and other health measures. With respect to agriculture production, expected food shortages and loss of jobs, and by extent, purchasing power will definitely have an impact on cardiovascular and other non-communicable diseases as it relates to diet. This is of concern, given that NCDs is one of the underlying risk factors for exacerbating COVID-19 complications and for increased mortality associated with this illness. Increasingly, variable rainfall patterns are likely to affect the supply of fresh water. Rising sea levels and increasingly extreme weather events will destroy homes, medical facilities, and other essential services. We have experienced that too often over the past 5 to 6 years, and I've had to visit too many disaster areas over the past 5 to 6 years by the various hurricanes. Almost all our economic activities and most of our housing stock are close to the sea. We will therefore have to grapple with a very real challenge of addressing the mental health implications of coping with property damage, displacement, loss of economic livelihood, and deterioration in sanitation and hygiene standards in the aftermath of tropical cyclones of increasing frequency and intensity. These cumulative impacts, colleagues, create additional challenges to already embattled SIDS health systems. The need, therefore, to strengthen health infrastructure and critical supply chains will require significant investments from CARIFORUM states to allow our health system to deliver quality services, especially during emergency situations. These concerns served as the impetus for the Caribbean Action Plan on Health and Climate Change, signed in Grenada by Ministers of Health in 2018. And this event, for which we are gathered this afternoon, is a direct response to the 2018 Action Plan. I am pleased that the design of the project, which draws on the Pan-American Health Organization One Health approach, is in accordance with the Caribbean Cooperation in Health Phase 4 framework. Implementation of the project will also assist in the realization of the Sustainable Development Goals, particularly SDG 3, which speaks to ensuring healthy lives and promoting well-being for all at all ages. While we have made significant strides regionally with our institutions doing excellent work, strong partnerships remain a lifeline in addressing our challenges. In this regard, the European Union and PAHO have been steadfast partners in many of the development pursuits of the region. And I join also in welcoming SICA and the Amazon partnership as well. I look forward to the outcome that will flow from this project, since it will allow us to improve our overall resilience and advocacy. I thank you.
Thank you so much, Ambassador, for highlighting a lot of those themes that our other presenters would have highlighted as well. And I'm particularly happy that you highlighted the Ambassador program, where there'll be a cohort of young persons who will be trained to address these issues, because we're key stakeholders in the climate change arena. We're the ones who will be inheriting a lot of the impacts as we progress into the future. So being able to provide the requisite skills and assets that will be needed to tackle some of these issues, that's very important. And I'm also happy that CARIFORUM is such a key partner and key stakeholder in the process pushing this forward. So thank you so much for the efforts. Thank you so much for the continued work being done. And our final presentation comes to us from Dominica. And as I had mentioned before, Prime Minister Skerrit is unable to join, and he regrets being able to join us this afternoon. But we will have Dr. Irvin McIntyre by video, who will provide remarks on behalf of the government of Dominica. So we look forward to hearing from them, and I will now hand over to the technical person who will play the video on their behalf.
Pan American Health Organization Director, Dr. Carissa Etienne, CARICOM Secretary General, Ambassador Erwin Larocque, Head of Delegation of the European Union to Barbados, the Eastern Caribbean States, and CARIFORUM, Ms. Malgorzata Wasilewska, Secretary General of the Amazon Cooperation Treaty Organization, Ms. Alexandra Moreira, General Secretary, Central American Integration System, Dr. Vinicio Cerezo, Heads of regional organizations, project partners, specially invited guests, members of the media, good afternoon. It's my pleasure and honor to provide remarks at the launch of the European Union CARIFORUM project on climate change and health. This topic is of critical importance to the Caribbean and also to the Commonwealth of Dominica as we aim to become the world's first climate resilient nation by 2030. This is a declaration our Prime Minister, the Honorable Roosevelt Skerrit, made at the United Nations General Assembly in New York in September 2017, just days after Dominica was ravaged by Hurricane Maria. Climate change is real. We have lived the consequences of climate change. While we have been calling on the doors of our developed countries to change their habits, we have been doing what we can to build resilience in our country. The government of the Commonwealth of Dominica has directed investments towards economic transition and recovery efforts. We are well on our way to achieving resilience in terms of infrastructure, economy and fiscal policies, and resilience in our health and education system. I will highlight some of our initiatives. Shortly after Hurricane Maria, the Honorable Prime Minister announced the formalization of the Climate Resilience Execution Agency of Dominica, CRED, to streamline procedures to incorporate resilience into all aspects of society. This initiative has received widespread support from the World Bank and governments such as the United Kingdom. Dominica is also proud of its 7-megawatt geothermal plant, which will allow us to benefit from clean, reliable, low-cost, renewable, high-quality energy supply. Once completed, all Dominicans will be provided with green energy from the geothermal plant with the potential to share with neighboring islands. The government is focused on building back better, a term widely adopted to the island's residents who are rehabilitating, rebuilding, or designing their homes. Through the Build Back Better initiative, entire dislocated communities have been offered free modern homes, newly built in safer areas and able to withstand the harshest weather conditions. This unprecedented housing revolution program comprises 5,000 units across the island for families that are affected by Hurricane Maria and Tropical Storm Erica. Dominica's plastic ban came into effect on the 1st of January 2019. We are proud that National Geographic described it as one of the world's most comprehensive plastic bans. The government provided all households on the island with jute and cotton bags to use as sustainable alternatives to plastic. We also banned styrofoam materials in our country. The Go Green Dominica initiative also applies a 0% import duty on authenticated biodegradable products and reusable shopping bags. Plastic is a major contributor to marine and land pollution, and the Go Green Dominica initiative will go a long way to protect our environment and put us in a better position to deal with the effects of climate change. Dear participants, natural disasters can have a major impact on the health sector and on people's lives. And we need to ensure that health facilities are built to withstand disasters while also being environmentally friendly. Dominica was one of the countries to receive support for the Smart Hospital program funded through the Foreign, Commonwealth and Development Office, formerly DFID, and PAHO-led. As a result, Dominica has moved forward a roadmap for risk reduction investment as well as green measures in hospitals. Smart standards were implemented in selective health facilities, and national capacity has been improved for health workers and users to manage and understand the value of these facilities. Dominica is now applying this smart model to other vital sectors such as education. PAHO and other partners' dedication to the issue of climate change and health over the past decade resulted in the development of a succinct and powerful plan for the Caribbean. This Caribbean Action Plan on Health and Climate Change was signed in 2018 with buy-in from 17 countries in the Caribbean and detailed a clear path for countries to take in order to prevent and prepare for the impacts of health. This plan provided momentum for addressing climate change in the Caribbean and proved to be a vital step towards the inception on an innovative and far-reaching proposal that would become the EU CARIFORUM Strengthening Climate Resilient Health Systems in the Caribbean. We thank the European Union for its contribution as a leader on climate action. Dominica is pleased to be here today in order to launch this project. Being a small island developing state, Dominica is highly exposed to multiple marine and land-based hazards that directly and indirectly influence human health. This presents a significant challenge for our sustainable development. After Hurricane Maria in 2017, our country was devastated, and this highlighted the need for strengthening climate-resilient health systems. Madam Director and colleagues, the EU CARIFORUM project serves to meet many of the public health system needs in Dominica and the rest of the Caribbean. Through this unique partnership across multiple Caribbean organizations, sectors, and across the 16 countries. The project fits directly within the Caribbean Cooperation in Health towards reducing mortality and morbidity from health consequences of climate change in Caribbean countries. This includes linkages to the environmental determinants of health and COVID-19 prevention and control. The project fulfills many of the aspects of this new path for the Caribbean in terms of establishing this multi-sectoral and interdisciplinary approach to elevate the importance of climate impacts on health. Furthermore, the EU CARIFORUM project represents the first regional interdisciplinary effort of its kind that will synergize Caribbean technical support, advance the public's understanding of the impacts from climate change on health, and build the case for strengthening the health response. Dominica fully supports and looks forward to participation in this initiative. As a country with first-hand experience, we recognize the importance of health in building climate resilience. I thank you for your attention and your commitment to improving quality of lives and successfully beat back climate change.
Well, ladies and gentlemen, Dr. McIntyre has highlighted how Dominica has sought to build back better with their focus on resilience and disaster mitigation and reduction. They've applied a smart approach that has been garnering benefits thus far. We have officially launched the event, so I must say thank you so much to everyone for joining, to our speakers who represented their individual entities, to the different stakeholders who are on board, to all the parties who are currently working towards seeing this project over the next few years be something that is not only a space for us to prioritize climate change and health, but also a space for small island developing states across the region, across the Caribbean, to be able to work together to see how best we can utilize and ensure that the resources that we currently have at our disposal are put to use, and to ensure that we climate-proof our existing sector, particularly those surrounding health, to ensure that we are able to garner results. So ladies and gentlemen, it has been my pleasure to have been able to facilitate this discussion this afternoon. There will be a lot more coming from this project, particularly as it relates to engaging stakeholders such as youth. And I'm happy to have been afforded the opportunity to represent the youth in this particular space. We look forward to your continued collaboration and work. And as we seek to close, I say thank you so much. And climate change is here, but with putting together our hands and hearts, as we say in Jamaica, we will see how best we can alleviate and mitigate a lot of these challenges. So thank you so much, and do in fact have a pleasant afternoon or morning wherever you are.